Well, people call the police for a variety of reasons: car crashes, crimes, even mental health situations.
And there's an effort meant to get officers additional training to handle mental health crisis situations. Andre Knowles joins us in studio with more on this important training. Andre?
Yeah, Jeff and Kaylee, law enforcement has access to free trainings, classes here in Lucas County. The goal is to teach de-escalation techniques they can use when responding to some difficult situations.
Police!
This is body cam video from last month. Toledo Police Chief Mike Trinley says a SWAT officer was forced to shoot and kill Erica Allen, who had a knife. The chief says that officer acted to save children. He called it a mental health situation, and the department says it's seen an increase of calls dealing with mental health since 2020. But who trains law enforcement to deal with these situations? That's where Mental Health and Recovery Services comes in.
We want law enforcement officers to go home safe. We want community members to go home safe. And so we want to give them the tools law enforcement needs to have very positive outcomes in our community.
Scott Silak is the executive director of the board. It's been funding crisis intervention training since 2001. Since that time, they've trained more than 1,500 Lucas County law enforcement officers and 911 dispatchers from dozens of departments. While this intervention can't help in every situation, Silak says it's important.
Law enforcement officers have traditionally been taught command and control, right? Well, that doesn't work with an individual who's going through a psychiatric emergency. And in fact, it may escalate the situation.
In a 40-hour training, they're teaching officers de-escalation techniques, like using a calm voice and starting a dialogue. But right now, they want Lucas County to know if you're in need, you can simply call 911 and ask for the Crisis Intervention Team, or CIT officer, to respond to a mental health emergency.
Their loved one going through a psychiatric emergency or just not really sure what's going on, requesting a CIT officer can't hurt.
Silak says that they have this training 4 times a year, but listen to this. He says these classes are voluntary, and each and every time they're full. The officers see the need. Reporting in studio, Andre Knowles, WTOL 11.